Welcome back to our Dan educational series on the heart, your health and diving. We're in chapter 3, in which we're looking at some of the structural abnormalities related to the heart. And in this section, we are going to be looking at valve disorders. Now, the heart has 4 main valves that essentially facilitate the pumping activity of the heart. There is the tricuspid, which means 3-leafed valve, which is between the right atrium and the right ventricle, from where blood goes to the lungs. And then there's the pulmonary valve, which is a second valve on that side of the heart, which then allows blood to move out of the heart towards the circulation that goes into the pulmonary circulation. On the left side of the heart, we have a mitral valve, and the mitral valve, because it looks a little bit like a mitre, like a form of a religious hat, if you like, a mitre, which is between the left atrium and the left ventricle. And then lastly, we have the aortic valve, which is between the left ventricle and the aorta. Each of the valves consists of a set of flaps or leaflets or cusps, as we mentioned, and they open and close to allow for a pulsatile flow of blood in the right direction, either towards the lungs or towards the rest of the body. Now, the function of the valves may be compromised by either congenital or acquired abnormalities, and damage to the valves can occur due to infection, rheumatic fever, or as a function of aging. For example, the opening of a valve may be narrow, and this is a condition called stenosis. What that means is that it makes it harder for the heart to actually get blood through, and generates higher pressure within the heart, and may eventually cause the heart muscle to overdevelop, become so thick that it essentially chokes off its own circulation. The other problem is that a valve doesn't close completely, and in that case, blood may flow backwards in a condition called regurgitation, incompetence, or leaking, which can then overload the heart in a different way because it has to work twice as hard to get the blood through, which may then lead to dilatation or widening of the heart's cavities. Now, there are 2 fairly common valve disorders, particularly in older adults, and in this case it is aortic stenosis. In other words, the aortic valve is shrunk or is narrow, and mitral regurgitation. The symptoms of valve disorders vary depending on which valve is affected, as well as, of course, how severe the change is. Mild changes may not cause any symptoms. Sometimes a murmur may be detected coincidentally, and when examined by stethoscope or with ultrasound may be assessed or identified and then evaluated. However, if the valve problem results in heart pain or angina, or a feeling of tightness in the chest, shortness of breath, fainting, and heart palpitations, this is a problem. In general, leaky valves are less of a concern to divers than narrowed valves. In other words, the heart having to work a little bit harder to get the same volume of blood through is typically less of a problem than the heart struggling to get blood through in the first place. Sudden death syndrome is something that has been recognized, especially amongst athletes, and is associated with a certain type of aortic stenosis, which is not necessarily the result of the valve, but it may be as a result of the heart muscle thickening to such an extent that blood flow is obstructed. Regurgitation or backflow of circulation is sometimes also detectable, and if it is significant, may also result in shortness of breath or wheezing, especially when lying down, and with exercise these symptoms may be aggravated, and these may further worsen if a person is immersed and in water. Now, the treatment for severe valve disorders generally involves surgery, and defective valves may sometimes be repaired or replaced, either with a mechanical valve or, in rare instances, even pig valves, in other words animal valves, to stand in for the human valve function. Prevention of valve damage is of course the best approach. Routine examinations may detect valve disease early on, and these could then be treated and observed, and interventions planned at a better time before the valve deterioration has worsened to the extent that it needs replacement or surgery, and that is something to keep in mind. So, what about the effect on diving? Well, significant valve abnormalities may mean that you can't dive until they're corrected, and even after they're corrected, there may be a requirement to be on blood thinners like warfarin, or there may be concerns about infection, or there may be concerns about leakage, all of which may be relevant to a person's diving fitness. Any evidence of lack of circulation, wheezing, heart dysfunction, or significant shunting, which means movement from the right to the left side of the heart, which means that bubbles from decompression can enter the arterial circulation, would preclude a person from diving. That is a fairly succinct overview of a rather complex topic. So if you have questions, we invite you to not only subscribe to the channel, which is always our open invitation, but to ask the questions and, importantly, get proper advice. Even cardiologists sometimes need to consult diving physicians in order to determine whether a valve problem is in fact relevant and a potential contraindication to diving. So make sure you get proper advice, and you can always call the Dan hotline for that. Until the next episode, safe diving.